We're going to get that elbow in full extension. Good. I'm going to support, it says the inside. I feel I can get a good grip here. You could, if you wanted to be by the letter of the book here. Actually, that's not too bad. And then I'm going to apply a varus force to the elbow. Excuse me, varus force to the elbow. Yep, excuse me. So I'm gripping right under the kind of joint line. If you think about it, if that ligament wasn't there, I'm going to get a lot more laxity of that elbow, a lot more movement of that elbow. I, with all these tests, like to do different angles just to be sure. So you could start with full extension. You might see people go into a little bit of flexion. So that way you're kind of getting a true, assessment of that ligament structure. Cool. And what I was doing was the valgus test. So same position, now I'm on the outside. I'm going to provide my force right through the joint line. You okay with that?
Yeah.
And again, I might go into a couple different positions, but I'll start in that extension. And I'm looking to see, is there a big kind of gap or pain reproduced with that. Cubital tunnel test. So I'm going to, this is going to look at our ulnar nerve. So here we go, here's the test, right? So if we're thinking maybe that ulnar nerve's a little involved, I'm going to take my patient's elbow into full flexion, full supination, and neutral wrist. So kind of understand this is where that nerve is most compact at, or under tension. So if I hold her here, we're going to watch a clock, we'll go a minute. If we are starting to get those symptoms of deep pain, burning sensation, numbness, tingling in the 5th and 4th digits, right? Then I can be probably a little maybe ulnar nervy, which then that's a great one for them to know, because then they're like, oh, I didn't know that was a really stressful position for it. Maybe when I sleep at night, I'll put some pillows underneath, I'll be in a little bit less. Maybe if it's a little more comfortable, I'll be down here. Oh, you know what? I'm always in class. Like this. I'm always in class and it hurts. Oh, why is that always?
I get no feeling every single day.
No way.
Today.
Right? So that gives you that cosins. Come up to, actually we can do this here, that's fine. Justine, can you make a fist for me? We're going to make a fist, we're going to go into pronation. And then I'm going to have you go into wrist extension with a little wrist extension. Good. And then come back down. Now I'm going to resist you on this one, all right? So here's the test. Push up. She's resisting me, and then I'm letting her win. But we're going to check kind of throughout the full range. Go again. So resistance, resistance, resistance. I'm applying a little bit more on the radial side so that she has to kind of go into a little bit of that radial deviation. But essentially, we're looking at that wrist extension. So your wrist extensors are mainly the ones that are affected with lateral epicondylitis. Right? If we're having them work against resistance, it's going to reproduce pain. Pretty good test. Maldsy. First, fully pronated, neutral position, downward force. Awesome. You're going to make a fist or display the hand for me. Good. We're going to keep them in that 90 degrees of flexion. Again, fully pronated, neutral position. I'm going to have you, I'm going to provide a downward force on this middle finger. Someone trying to get it? All right, try to resist me. Oh, gotcha. So resist my pressure here. Reproduction. So we're getting a little wrist flexor. Your extensor, carpe, something, something. They all come into that middle finger. This is where you're getting a little bit more of that best leverage. should reproduce pain into that lateral elbow. I'll say one, it's not on here, but the other one that you'll commonly see then is just taking them into passive wrist flexion. Sometimes this is enough. Just even stretching those muscles, tendons produces the lateral elbow plane. You could even go a little further. Now I got that elbow extension. You feel a stretch there?
No.
Maybe, yeah, it doesn't feel much, but they should. Sometimes they'll get a little elbow pain there as well. So it's just another test. Golfer's elbow test. You're going to passively flex the elbow to 90, supinate the arm, and then you're going to extend the elbow and wrist. So as I take them into that extension, now we're doing the opposite. We're stretching out those medial wrist flexors, right, by extending the elbow, wrist, right? So my wrist flexors get stretched when I wrist extend. Reproduction of pain in the medial elbow. Yeah, it's
You
good.
know what I'm confused about? Like the mechanism of injury for golfer's elbow.
Yeah.
Like which arm is it? The trailing arm, the leading arm?
Oh, that's good. It's typically going to be on the lefty. So let's just start there if that throws you off.
Okay.
So it's going to be my trailing arm.
Okay, and that's gonna put stress on the medial compartment.
Yeah, so watch this.
Okay.
Let's say we're going to imagine I hit the ground. So we're going to use the table here. If I come in here,
Okay.
boom, right? All that force, that humeral bone wants to go this way, that's stopping it. Bam, just like a rubber band just got, boom, hit, right? You're probably out there like, that hurt.
Mm-hmm.
Let's do it again. Bam, God, I got to get better at golf, right? You do that a couple times. Even when you hit the ball, right, there's a small force, right? Because even contacting the ball, there's some resistance. That's the theorized mechanics, or why they call it golfers, right? But you'll also get, I mean, you will see this, I know we talked about lateral epicondylitis with like hammering. I mean, same thing though. I mean, you're still getting some of that. Yeah, not sure. Well, this time it would be like over repetitions if I was doing hammering this way. Or, you know, typing. I'd say a little bit more lateral, but still, you're going to see it, you know, there's not like a classic, we say golfers and tennis elbow because that's like when they were first studying these back in the 70s and 80s, it's like just the population they would